my skill assessment, my armamentarium is my mirror, my marquee probe that is marked at 3, 6, 9, and 12 millimeters in the black bar. I'll have my glasses, my mask, my puffy. My patient will have glasses on and a patient napkin. I also have my floss and my cotton forceps for when I check for mobility. Also, I will ask my patient before I start if they've ever had any history of periodontal disease or history of scaling and wound tightening. Okay, so good. Okay, so my teeth that I will be looking at probing will be number 8, lingual, and I will be at the 12 o'clock position for that. My patient will have his head up. Finger grip. And so I'm going to insert and lock it 1 to 2 millimeters up. Sure. 2 millimeters. And so then you get to the contact area and then you slant in. Okay, so now we're going to check for recession and we'll measure that, and that looks like it's at a 3, and then we'll check for bleeding. All right, and now we'll go to number 14, buckle, and I'm going to be in the 11 to 10 o'clock, or no, 1 to 2 o'clock position, sorry. And I'm going to have my patient turn away from me, and I'm going to retract like this. So it will be in and walking along. And get to the interproximal and slant in. And then come out and we'll check for recession. And that'll be a 3. And then we'll check for bleeding. We'll go to 24 facial, and I'll be at the 8 o'clock position, or 4 o'clock, I don't know. Retract, and to the contact and slant in, come out, check for recession. 3, and then check for bleeding. And now we'll do 30 lingual, and that is a surface away. So I will be at 1 to 2 o'clock and patient away. And retract the tongue. Thank you. And so then slide in and walk across. And contact area and slant. And then check for recession. So like 3, and then check for bleeding. Okay, So now I'm going to check for mobility. And I'm going to come back up to clock and tooth number 8. And I'm checking for 1, 2, or 3. There's no mobility there. And 14. And I would say 1. And then 24, checking for mobility. I would say that's a 1. And 30. So now we'll check for the lingual frenums to see if there is any diastemas or any recession in 24 and 25 area. And then we're going to ask the patient if they notice anywhere that catches any food. And we'll check with floss any of the areas that he wants to, that he has any food. And we're looking for also any open contacts that may be present. This is when, if I had my neighbor's probe, I would check for furcations on any of the molars. And I would be looking for classifications of 1, 2, 3, or 4s. 4 is when you can see all the way across from, buccal to lingual with the probe inside. And then 3 is when you can slide it in, but there's gum tissue on the lingual still. 2 is where you can slide it in, and then 1 is where you can feel the furcation. Maintain asepsis.
Take a bow.